Hi everyone, this is Rohit from Practice by Numbers. Today I'm excited to launch the beta test of our newest feature, Automated Patient Tasks. This has been one of the most requested features and we're finally ready to start our beta test. This beta test is invitation only for the practices that have expressed interest. Today we started with 4 practices. If things go well, we'll open this up to the rest of the practices that have expressed interest in this beta test. And in about 2 to 3 weeks, assuming all goes well, this will be released to all of the practices that have Practice IQ subscription. So how does this work? You go into Revenue IQ. On the left side, you will see automatic tasks. You click on that, it will give you the list of built-in tasks that we think make the most sense, and then of course you can edit them as you wish. So how do you activate it? Click on any one of these. All these are macros that have not been activated. You can click on any one of them. So for example, I'm going to look at the treatment task. If I click on this treatment task, it'll bring up the type treatment. So you can choose all treatment for now. Okay, that's what I'm going to do for this particular task. You can choose a team member if you so wish to. So I'm going to, let's say, pick one of the persons over here as a team member, that this task will go to that person. And what this is going to do is it's going to look for anybody in the office 3 days after they left, or today, if I'm looking, it's going to look for patients that were seen 3 days ago that have pending treatment that has not been scheduled yet. Okay, and it's also going to say last contacted is, there's no limit over here, and they don't have an appointment upcoming in the next 30 days because you don't want to quite follow up with a patient who's already coming back. After the initial follow-up, it's going to add 2 more follow-ups that says one follow-up is 7 days after, so that's a week after, and then 3 weeks after. And what this is going to try to do is it's going to make sure you're trying to close that back door in the office, that there is a structured way of following up with patients. And the way you want to test this is, for example, for today, 12/11, if this task was active today and automatic tasks were created, how many tasks would get created? If you see right over here, there's all these patients that had come in 3 days ago that did not schedule their treatment. Okay, and if I test this for, let's say, Saturday, and I hit test again, there will be more people. So this is a way moving forward for people who are coming into the office. You want to create automatic tasks for them, for your staff to follow up. This is how you do it. This does not replace Revenue IQ for patients who had treatment presented 2 months ago, 3 months ago, 6 months ago, that you want to still follow up. You would use a regular Revenue IQ for that. You can play around with any of these dates as you want and then hit update. There are other ones. Let's go ahead and activate some of the other ones as well. Upcoming recall campaign. It's pretty obvious what it means. These are people who have recall coming up. I'm going to do same exact thing, assign it to a team member, and I won't change anything. But what this means is these are patients that have recall coming up in 30 days, but they don't have a recall appointment. So the first follow-up is in that 30 days, then 7 days after, and then 21 days after. One thing to note is all of the tasks have an expiration date. That means as our system creates these tasks and puts them into the task pipeline, 30 days or whatever expiration date you set, from now the task will expire, so that it doesn't continue to build up a huge number of tasks in your task list. But this would be a good test to see how many tasks are being followed up, how many tasks are actually being converted, how many tasks are being completed. And then we will create KPIs based on how many tasks were created, how many tasks were actually completed on time, what were the outcomes, and how many tasks just expired. So let's go ahead and update this one as well. And I'm going to do another campaign for overdue recall. This one, again, pretty simple. 7 days after the recall was due, a task gets created. The first followed up after that is 7 days, then 3 weeks, and then 2 months. Let's update the fourth one, reactivation. Patients who have not been seen for 12 months. Okay, that's the last visit date, 12 months. And then 3 months after that, and then another 3 months after that. And the next one is actually canceled and failed appointments. Patients who canceled or failed their appointment 7 days ago but don't have a future appointment. So there's a task that gets created, followed up by 7 days and then 3 weeks. And lastly, the third one, the final one is pre-appointments. Let's go ahead and create this one as well. Patients who came in for any one of these services, and again, you can go and edit this as you wish. So for ortho patients, for example, you may have a periodic ortho visit where patients come in, but they haven't scheduled their next visit. You can create an automated task for them as well. And they don't have a future appointment of any service in the next 270 days. Okay. So next day morning, when you come in, you will see tasks getting created automatically. And you will see this task window light up with the number of tasks that are due. And then all you have to do is go in here, whoever the task is assigned to, they will see these tasks and how many are overdue, how many are due today, due tomorrow, and all other tasks. And there's a little A next to it. What it means is that the task was automatically created. Okay, well, try it out. We think this is going to really help practices create patient follow-ups in a more structured way. We'll be looking for feedback on this feature, hoping to make it better and more useful for practices. Again, this is Rohit from Practice by Numbers. Hope everyone is having a good December, and we'll talk again soon.